Hi, I'm Ryan Curran, and this is my presentation, my PowerPoint presentation on anaphylactic shock for Dr. Dominic Stur's Kinesiology 212 class. So start off on the first slide, and we see something kind of comical off to the left, a comic strip. It says, "Are you allergic to anything?" I mean, aside from whatever it was that bit you. I found that amusing, but anaphylactic shock is very serious, obviously, and something that I found out this summer when my sister's dog got stung by a bee and had to be rushed to the vet. She was okay. Anyways, let's move on. Okay, so what is anaphylactic shock? The American College of Allergy, Asthma, and Immunology define anaphylaxis as a severe allergic reaction that happens when an over release of chemicals puts a person into shock. So pretty much it's a very severe allergic reaction. Anaphylaxis or anaphylactic shock is the most severe version of an allergic reaction. Death may occur during severe anaphylactic shock within minutes, which is one of the reasons that it's so serious, because of how quickly the onset of the symptoms are and how quickly a possible fatality can arise from the situation. Emergency management is extremely important. That is definitely something that, like I was saying with my sister's dog, that we experience very quickly, is how sudden a lot of the side effects are that you notice, and how quickly they occur and their onset, and how quickly you need to be able to react and do the proper things to deal with the situation. Okay, so prevalence of anaphylactic shock. According to the Asthma and Allergy Foundation of America, 1 in 50 Americans will suffer anaphylactic shock. They also reported that the number is most likely higher, maybe all the way up to 1 in 20, but that the 1 in 50 has been proven. The 1 in 20 is more of a theoretical possibility, but they believe that to be potentially more accurate. So now we'll go over causes of anaphylactic shock. As you can see, I have a bee in the top right corner and some evil looking fruit in the bottom left, which can potentially both be causes of anaphylactic shock. So there are a variety of allergens that can cause anaphylactic shock. Anaphylactic shock can be caused by food allergies, insect stings, commonly bees, but other insects too, medications, and latex allergies. That information was from the American College of Allergy, Asthma, and Immunology again. And according to a study, drug-related anaphylactic shock is responsible for between, surprisingly, 35 to 45% of all cases. That was a pretty shocking statistic to hear, because when you think about anaphylactic shock, you think more so about maybe bee stings and peanut allergies more so than medication or drug-related incidences. So let's go over the signs of anaphylactic shock. And this is a form from the Center for Wilderness Safety they put together. So we have here a good overview of how it can affect the body in many ways. 80 to 90% of all reactions, or people who are having anaphylactic shock, experience reactions on the skin and to the airways. So those are the two most common. And then after that, cardiovascular system would be affected to 30 to 45% of people, and the GI tract also 30 to 45% of people. And then the central nervous system is a little bit more rare, where 10 to 15% of people are affected who are going through anaphylactic shock. You can experience things on the skin like hives, itching, flushed skin is really common. Swelling of lips, tongue, and throat and face is also extremely common. And in the airway, tightness and swelling of the throat, scratchy throat, trouble breathing, wheezing is also extremely common. Those are the two most common things that you're going to hear from people that are experiencing it, is itchiness, a rash on the skin, and trouble breathing, most likely. And then you can feel chest pain potentially. Low blood pressure is also pretty common, especially if it's extremely serious. Rapid heart rate, because the heart rate is trying to make up for what is going on in the body, and it's feeling injured, doesn't know what to do, so it's pumping more blood to help the affected areas of the body work more efficiently. In the GI tract, nausea, abdominal cramping, vomiting, and diarrhea are common. The diarrhea one is actually interesting, the GI tract, because when my sister's dog experienced anaphylactic shock, she was defecating all over my sister's car on the way to the hospital. So, things like that are not something you necessarily expect, but they can definitely add to the how scary the whole situation is. And the central nervous system can be affected by anxiety, headaches, dizziness, confusion, tunnel vision, and fainting, which they misspelled, but we get the picture. All right, moving on. Treatment and response. Okay, so this table was taken from the American Red Cross manual, CPR manual, on page 81. This table is more so used to how to identify if somebody's going into anaphylactic shock. So we look at the situation. We'll quickly go over this. So situation 1, you do not know if the person has been exposed to an allergen, and what you want to look for is a skin reaction, swelling of the face, the neck, tongue, lips, and you want to look for trouble breathing or any other signs, symptoms of shock that you know. So like I said before, swelling of the skin, itchiness, and trouble breathing is really common. Next situation would be you think the person may have been exposed to the allergen, and you look for any two of the following: any skin reaction, swelling of the face, neck, tongue, or lips, trouble breathing, signs and symptoms of shock, nausea, vomiting, cramping, or diarrhea. Pretty similar to what we went over before. That has added the GI tract traits or symptoms into this too. And then the third situation is that the person has been exposed to the allergen. So all you need to look for is trouble breathing or signs and symptoms of shock. So let's move on from that. And this is treatment continued. Here's what you want to do if you know somebody is going into shock, or if you think the potentials are there for somebody going into anaphylactic shock. Have someone call 911 immediately. If the person carries medication or epinephrine, offer to help them to use it. A lot of people who know they have anaphylactic shock or are prone to it will carry an EpiPen around. So if they're out of it, and as we previously mentioned, confusion can be a trait, or a symptom of anaphylactic shock. They might be struggling to perform the EpiPen puncture themselves. You may have to help them with it. If you're alone, help administer the medication first and then call 911. That's important because the medication can potentially save their lives, and it's more important to do that right away if you know they have the medication than it is to call 911, but do both very quickly. Medication first, 911 second. And help the person lie down or sit comfortably if they are showing signs of shock. So just get them in a comfortable position. They're feeling lightheaded, you can lay them on their back with their feet up. And these are all tips that are from the American Red Cross. Prevention. To prevent anaphylactic shock, stay away from foods or anything you're allergic to. Pretty common sense stuff for people that know they have the allergy. Gets a little bit more tricky if you don't know that you have the allergy. If you're someone with a severe allergy, wear a medical bracelet or necklace that lists your allergies too. And that's important if you're someone who's around, who's going around by themselves, because let's say, for example, you're going on a hike, you get stung by a bee, and you're kind of in the middle of a trail or the wilderness somewhere, and you pass out because of the anaphylactic shock. You're going to want the person who comes by and finds you there to be able to call 911 or help you and read on your bracelet or a medical necklace why you have passed out. Because if you come across somebody passed out on the floor, there could be 1,000,001 reasons why that person's there. So at least you help them narrow down. So when paramedics get there, or if they are experienced and know how to deal with something like this, that will definitely quicken the process of helping you out. This is prevention continued. This is again from American College of Allergy, Asthma, and Immunology. So they have a list here of ways to prevent or help prevent going into anaphylactic shock. 1 is to know your trigger. 2 is to avoid the trigger. 3, be prepared just in case you can't avoid the trigger. 4, seek treatment immediately. 5, tell family and friends. Have people around you that are aware of your situation so they can help you. 6, wear identification. It's really important. And 7, see a specialist. See your doctor and figure out what the correct method of prevention would be.